Okay, I think we're at the top of the hour, so welcome to the Greener Care Special Interest Group Roundtable. I'm going to hand straight over to John.
Thank you very much, Elaine. How lovely to see you all. Thank you so much for coming along today. My name is John Wilkes. I have the absolute privilege and pleasure of being the Chief Executive of the Institute of Health and Social Care Management. And I thought it might be worth just starting the introduction to a conference all about sustainability of an environmental type with a message about the sustainability of our organisation. So for those that you may not know, we've been around since 1902, so we predate the NHS itself by 46 years. And you've got to ask yourself, well, why? How come an organisation like this has been able to survive the trials and tribulations of all of these years, whilst the NHS has been going through all kinds of change and so on over the time, and indeed society and the environment in general has been going through changes of all types. And I think the overriding factor is perhaps consistency, that our institute from the outset has been very clear what its purpose is. We're here to support and encourage the development of our individual members, and perhaps having that absolutely sincere and consistently held means of purpose is what this is really all about. In other words, environmental sustainability, to move on today's topic, shouldn't be something that is kind of here today and gone tomorrow. But if we want it to be something that we can genuinely aspire to achieve, then it's something that we have to hold in our hearts and decide is truly important to all of the activities that we undertake across health and social care, and it needs to be a factor across the whole piece. My worry, I suppose, is the ebb and flow nature of the focus that environmental sustainability has been seen to typically receive. And that worries me. I know it certainly worries most of you on this call, and it certainly worries Elaine. And I hope that it worries the NHS organisations across the 4 nations that make up the United Kingdom, because the idea that it can be allowed to ebb and flow in terms of priority, I think is ludicrous. We either believe in the merit of it or we don't. And the fact is that we are bound in from the 2020 commitment to net zero by 2040. We're bound into this, and therefore we've got a treaty of sorts, if you might describe it, that determines that this is something that we have to do. My worry now is, well, I don't see very much evidence of genuine commitment to that currently. All of the mood music I'm hearing at the moment around things like the 10-year plan, and I'm not going to bore you with the 3 key elements of that, all of the mood music around, in particular, NHS England's quarterly board meetings, I don't see any great attention to environmental sustainability, carbon reduction, greenhouse emissions, and so on. I see nothing. I know it's not even on the current NHS England quarterly board meeting agenda, which means to me that it's not really receiving any great attention, and actually the organisation's priorities are elsewhere, predominantly, it must be said, financial and clinical. So that's the context that I see now. If you look at the wider world in particular, obviously the advent of President Trump's second presidency in the United States, the emerging conflicts taking place across the world, and the determination of the major nations to be the dominant players in global geopolitics and global geoeconomic terms, means that, again, I think the idea of environmental sustainability and carbon reduction has gone down the list of global priorities. And then one only has to look at the activities of petrochemical companies and such like to know that actually there's been a pivot really back to what we might rather disparagingly term the traditional means of energy generation and long-term energy planning. So it's in that rather disappointing, rather desperate even environment that here we are as the Institute of Health and Social Care Management, proudly looking up as our flag flutters at the top of the flagpole. And there it is fluttering away, talking about sustainable solutions for systemic challenges across the NHS and social care. And be assured that your professional institute will continue to have that sustained approach to this most important subject. So I appreciate the rest of the world may be changing. The rest of the world may be choosing to pivot. Health systems, social care systems elsewhere in the world may not give it the attention that it deserves, but we believe in it and we will continue to believe in it. And the very fact that we have so many of you here today proves to me that actually there's plenty of our members who believe in it. So with that, Elaine, if I may, I'm going to hand back to you so that we can discuss this in the usual enthusiastic, inspiring and uplifting manner that Institute of Health and Social Care Management events always seek to achieve. And I just want to say thank you to all of you for your continued support and enthusiasm for this concern, and you can be certain that your institute will continue to hold it as a priority. Elaine, back to you. Thank you.
John, thank you so much for that introduction. I think I could summarize that by saying John's reminding us, guess what? It's up to us. So I'm looking forward to us talking about sustainable solutions for health and care today. And I wanted just though to tell you a little bit about the Greener Care Special Interest Group, because we'd love you all to continue to join us. So this is a group that the Institute set up, and it involves members from all areas, hospitals, community services, care homes, but also from the private sector and suppliers. And we also get fantastic insights from retired members and those with lived experience. So it really is a welcome. Please come, please talk to us, please come and let's all learn and share together. And very relaxed meetings, but it has the purpose to engage and inspire you as members, for you to actually take action wherever you work. Because as John was alluding to, I think as it's up to us, we need to move more from interest to action. And we do want you to be able to steal ideas shamelessly, and we hope our participants today are going to give us some great ideas that we can share. This is the first of a series of roundtable events where we're going to chat about sustainable issues, and this is about systemic changes in relation to delivery of greener care. And my own experience is that often, and I'm afraid to tell you, I was one of those people. I was so busy. I was saying, yeah, this is really important. We're busy doing this over here. And of course, I think we now realise that we have to do this as well at the same time. So our four fantastic participants who are sitting with me around that virtual roundtable today are very happy to chat with us about their own experiences as busy people and what makes them interested in trying to make greener care and health and care more sustainable. So I'm going to let all four of them introduce themselves, but can I in advance thank Charlene, Tony, Lindsey and Hatu for giving us your time today and sharing your experiences. So maybe if we just go round briefly, maybe Charlene, I'll start with you if that's okay. And please, if you can all just introduce yourself, tell us a little bit about what you do and maybe just what's made you interested in sustainability and greener care. Charlene.
Hello everyone, thank you for joining today. I'm Charlene Adutwim, I'm the Regional Business Manager for ECL's Mid and South Essex Reablement Services. And for anyone I haven't met before, I lead a therapy-led service supporting people for up to 6 weeks to regain independence and confidence following illness or a hospital discharge. So I'm personally responsible for a workforce of around 325 colleagues, and that's across Mid and South Essex. And that brings together multidisciplinary frontline teams and operational support functions that enable safe and really responsive delivery. So I've worked over local government and the wider health and social care system for around the last 16 years. And over that time, I've held roles both across frontline services and also commissioning. So today I'm really looking forward to learning from different perspectives, and I'd love to leave the session with a few really clear ideas that we can take forward as an organisation. So thank you once again, Elaine, for having me, and I'm really looking forward to the discussion.
Great, thanks very much, Charlene, and welcome. So can I move Lindsey to you now? Would that be okay?
You can.
Thank you.
I'm Lindsey. I'm registered manager at Elaine Mead Quality Care in Plymouth. I've been a registered manager for nearly 5 years. I've worked in the care sector for 32 years, so I started when I was 16. So I've seen some huge changes from then until now. Our care home specialises in caring for people living with dementia. I am quite passionate about being green because I think during COVID, because of the risks, obviously the use of single-use plastic just absolutely skyrocketed. And I think it brought to everyone's attention the amount of waste that we produce as care homes. If you've got 40 residents in a care home, the amount of waste you produce is astronomical, and it's just trying to reduce that, I think, is a priority for us, as well as try and be sustainable for the whole environment. Everyone sees it get hotter in the summer, it's getting colder in the winter, you know, and we're doing that. So yeah.
Lindsey, that's fantastic. Thank you. I think we all recognise the huge amount of PPE that was around the place. So I think that did bring it into sharp focus. But as John was alluding to, that seems to have, people have forgotten a little bit about that now. So I'm sure we'll get into some of that. So Hatu, can I come to you now? Welcome.
Hello, thank you for having me. My name is Hassanatu Hawkins, also known as Hatu. I'm the registered manager for IHSCM Healthcare, and my role is to lead the organization in delivering safe, high-quality person-centered care across domiciliary support. And we support people within their own homes and community. And this means our environmental impact is shaped by mostly traveling. And we see this across because sometimes you would have different clients at different places, and trying to kind of reduce our carbon footprints can be a bit of a challenge. So our aim is to ensure that we kind of reduce this as much and try and work in different kind of hubs, so that we use people within the local environment and ensure that we try and make this as part of our daily practice. And we start by doing it now, because for us, it doesn't feel like we have to wait tomorrow or in the future. It's all about starting now. So we've started impacting these small changes, and I'm looking forward to see what else we can learn and even go better. Thank you.
That's great. Thanks, Hatu. And already a great message. Start small, start somewhere. I think that would be one of the maybe takeaways from today already. But before we get into the questions, Tony, I know we can't see you today, and I'm really sorry that you've got a problem with your camera, but I'm sure we can hear you loud and clear. So could you just share with us a little bit about yourself and what's made you interested in sustainability?
Yes, of course. Well, good afternoon, everybody. My name is Tony. I've been a chief exec of trusts, foundation trusts, CCGs, PCTs, health boards. I was appointed by the Prime Minister as the lead assessor for all research in the NHS. Been a senior lecturer at UCL for a couple of decades. I was the former PFI lead nationally. I was the regional director for strategy and estates in London, home counties and East Anglia. And I'm now happily retired. And I'm leading a small company called TSDI, and we specialise in the retrofit of heritage properties to achieve carbon neutrality, 100% renewable and sustainable energy use. I've won a Carbon Trust Green Award for breakthrough technology in carbon reduction. I won the Coyote Gold Award for what I did in the Morvan and their 5-year green strategy, and I launched the Healthy Housing Programme in Scotland. My interest. Well, we live in a society that is addicted to the use of fossil fuels. And like any other addiction, there is no single cure. While those addicted are unlikely to actually listen to or be persuaded by evidence or statistics or science, We need to learn, therefore, from our success with other addictions, including developing practical working models and demonstration sites that satisfy the short-term comfort needs of the addicted while achieving the longer-term climate, renewability and sustainability agenda. My interest is in seeing whether we can bring the success we have had in other addictions to this addiction.
You're absolutely right there, Tony. I think we have been brainwashed into that. So here we are. So let's get into some of the questions then that we've been trying to put together to try and understand just about what are some of the challenges that we're facing when we're trying to do this, because it's not easy, and what might be some of the solutions you've already come up with. So I'll come back, Charlene, if I may, to you, but in your organisation, have you got sustainability goals, and how do they support that patient care and community wellbeing?
Sure. So ECL is the company that I work for, and we are a local authority trading company. So we tie into the wider Essex County Council's sustainability goals. Within my service specifically, we're aiming to be more effective and efficient in how our community-based care workers impact the environment. Like Hatu was saying, primarily, this is through improved planning and embracing digital technology. We're really trying to streamline our visits and to improve routes so that our staff are remaining local. They're not needing to drive quite so far in the community. More widely, because we have many different services within ECL, the entire estate and all electric contracts are now 100% renewable, and we're looking at the possibility of becoming carbon neutral as an organisation as well.
Fantastic. So that's a great ambition, but big hill to climb. Yeah. So where have you started, Charlene? What is that around awareness with staff or having conversations about greener issues?
I think that tends to be more focused towards our actually how we operate as a business. So
Right.
we have a really strong technical back office team, including planners, our BI team, to kind of give us that insight. And what we, I think the struggle for us as a reablement service is we support people for up to 6 weeks. So most adults are with us for sort of 2 to 4 weeks. So there's this constant turnover of people in our service, which means our routes can't be tweaked and improved and honed over time. It's a really fast-paced service. So we've just moved to a new digital system. It's sort of rolled out over the last quarter that will give us better control over batch planning to help with continuity of service. Our real aim is that people are spending more time face-to-face with the adults they're supporting and less time on the roads. It's better for the people that we're supporting. It gives them better outcomes. But then it also means that we're not in the community driving around having that impact. And there's lots of different ways in which we are engaging with our staff, because we really love kind of the grassroots ideas that we have coming through. And I'd love to share some of those kind of over the course of today.
Perfect. So I'm going to come to you, Hatu, now, if I may, because you raise similar issues about transportation and travel. How are you managing to identify these in your organisation and start to take action?
Well, we identify it very early on because within where we are situated, which is within the West Midlands, they are such a traffic-orientated place where our carers can be stuck in traffic for ages to get to calls on time. We found that Greener Care works better for us, so we built that into our everyday practice. So within the home care, we reduced the traveling time by keeping our carers working locally. So they start and finish closer to their home address, so that they don't have to travel long distance. We also introduced one trip. So that one trip is for planning for shopping, pharmacy, calls, well-being checks, and all of that. We kind of group that to happen in a single day, so that we're not sending different carers back and forth. In our supported living, we run like weekly energy walkthrough to cut down the task, to cut down electricity, and we only use PPE for tax base. So not like before where you just use PPE in and out of any visits. So now we kind of reduce gloves usage, and we also move into all digital recording, so we're not using paper. Everything is all kind of digital based, and the experiencing is showing that with greener care doesn't have to be later, it has to be now. It has to be practiced in the day-to-day simple tasks that we do. So we try to kind of use, where possible, public transport, and then we encourage some of our carers that live close proximity to ride on bikes. So we're trying to events like different ways where we can add to the positive greener workspace that we want to proceed and build.
Fantastic. Some of what you're both describing is around being more organised and being able to do things once rather than a few times. So I could see Lindsey nodding. So I'm going to come to you, Lindsey, now. A lot of that resonates in a care home setting as well, I guess.
It does, yeah. So for us, we kind of started small. When I first joined Sunnymead, it wasn't very green at all. It was just like every other care home, I suppose. You know, you just day to day, you prioritise what's happening that day and don't really look at the bigger picture. So we're almost paperless now. So using various different apps to perform all the things that do all the recording that we were doing, from wages to rotas to timesheets, care plans, all that kind of thing are all digital now. We encourage our staff to either car share. We have a couple that cycle to work. So trying to rota around those staff that live on others' routes so they can be picked up, dropped off, that kind of thing. Conscious continence.
Right.
For obvious reasons, the more you take people to the toilet, the less continence products they're going to use. You know, it's using single-use plastic, using it for just personal care, not for everyday, you know, walking around the corridors with gloves, aprons on. Aprons in the kitchen, using washable cotton aprons for the carers to use rather than the plastic aprons that they have to put on every time they go into the kitchen. So each carer has their own apron for that shift, and then it's washed and reused. Composting, trying to reduce food waste. Just all those things, really, all the small things that together add up to quite a lot, but they're not overly expensive things to do. Sometimes it's cutting cost by using less reusable plastic, single-use plastic, that kind of thing. But yeah, some of it, the apps cost.
Of course.
So there is a financial implication there, but
yeah. And I'll come back to you, Lindsey, about how staff have reacted to that maybe in the next round. But some great examples there. And actually, some of those things we probably do at home already that I can see you're now applying into a care setting, which just makes sense, doesn't it? So thank you for that. Let me move to Tony next. So Tony, you've heard what colleagues have been saying. Your business is a little bit different. So how do you...
It is indeed. We're working on sustainability in possibly the hardest sector to achieve that in. That's the heritage sector. We chose that sector deliberately because if you can do it in that sector, you can do it in any sector. Has been our motto. We have one organisational sustainability goal at this moment in time, and that is by 2030, 100% of all the designs of new houses will be both healthy and affordable. To achieve that, we have a range of technologies and range of advice that we offer free to those who are developing housing. Our interest in today's meeting is that 11% of the housing stock is occupied by people working in the NHS and social services. 40% of the housing stock is occupied by people cared for by the NHS and social services. If we want to make a difference, therefore, to the biggest impactor on on the climate, which is the amount of carbon generated and greenhouse gases generated by the householder, doing it through the NHS and through social services strikes us as the best way to achieve that. You're in every community already, you're in the majority of houses already. What we need to do is provide the information, the resources to enable people to see how easy it is with existing technology to achieve zero carbon housing, 100% renewable, 100% sustainable, zero monthly cost housing. We've set ourselves a target that the overall financial bill for a household per bedroom will be £170 a month. And that includes mortgage and insurance. And we have achieved that in our first project. Our ambition is to deliver genuinely affordable housing, which is healthy and sustainable and renewable. And in fact, for those who are addicted to fossil fuels, you can't deliver low-cost housing using fossil fuels, but you can with renewable energies. And we have proven that.
Wow.
So
Fantastic, Tony. And do you think there's an appetite from developers now? Is legislation pushing them in this direction? No. Okay.
No, I think there's a knowledge deficit.
Yeah.
Many aren't aware of the new technologies out there. Many aren't aware of the practical demonstration sites. We've been lucky to find some with an appetite, but most do not have an appetite. We think it's back to this addiction. We've got so used to using fossil fuels that the mindset shift that needs to happen, that paradigm shift that needs to happen, is difficult for people unless they can see a practical example that deals with the immediacy of the current financial problems, as well as the longer term climate issues. It's back to John's statement right at the outset, when we've got this clash between survival as organisations and long-term survival of the planet, we are not prioritising the right things necessarily. And a large chunk of that is there needs to be somebody in the equation who can do the thinking, can do the research, can put together the demonstration sites and the models, can bring people to those demonstration sites and say, look, it's actually working, it's real. This isn't just words, this is practical examples of houses that have changed to the point where they're now carbon neutral. And as I say, doing it in the heritage sector has proved harder because we've then got the conservation feature as well. But we've cracked it in a couple of those already.
Well, I was going to ask you about that actually, Tony, because great bravery to start off with that sector. But lots of our facilities and buildings are actually pretty ancient, maybe not quite as old as the Institute of Health and Social Care, but nevertheless, they've been around a while. And do you think we've been almost brainwashed into thinking you can only bring in these new solutions if it's a new build and people are waiting for that, rather than going as you are to tackle some of these really tricky longer term issues in older buildings?
I think the term brainwash is a very wise one, very apposite. We started, of course, in a situation where everything was under Crown immunity until 1990. We lost a lot of time against other organisations in the period up until 1990. In the 30 years since, the PFI initiative really handed the agenda over to other parties rather than us grasping the agenda and grasping the opportunity NHS presents as 1 million people in thousands of communities, of being the organisation who champions and acts as the ambassador in every community. Now, one of the things we do in our organisation, for instance, we reward our staff if they join parish councils or local authorities or act as volunteers to those groups with bursaries, because we feel that having the voice in at that level is absolutely vital, particularly parish councils, because if you want to change the design of hospitals or clinics, care homes, etc., you start there on the planning route, not anywhere else. The one thing we've missed is the opportunity to get in with REBA and the other architectural institutes. And we're now trying to do that because we've discovered the other deficit is amongst architects. Most architects have not been brought up in sustainability technology and design.
Sure.
And we feel that's a deficit that, again, examples and demonstration sites will resolve.
Fantastic, thank you. Well, I've inadvertently taken us straight into some of those challenges that are being faced, so maybe we'll carry on from there. And Charlene, can you tell us a little bit about the challenges that you've been facing in trying to implement some of these practices?
Absolutely. I think the roundtable is actually, it's arriving at a point where health and social care systems are having to manage two priorities. So on the one hand, we've got the fact that the system needs to work faster, it needs to respond more urgently, there's more pressure in the hospital, and we need to create more flow through the hospitals and the community pathways at speed. But then on the other hand, I'm really conscious that we can only do that in a way that's genuinely sustainable. And that's in addition to being environmentally sustainable, it also needs to be financially, operationally, and ethically sustainable, with a workforce that's protected rather than depleted or burnt out. I recognise that there's a real temptation when sustainability is discussed with commissioners, either that it's not really something that you feel is genuinely adding to a commissioning decision, or the frame gets narrowed to carbon reduction alone. But in community care in particular, for me, sustainability is very much about, it's a broader picture of delivering care in a way that's mindful of the finite resources we have available to us, but also the impact that we're having in our communities and on the planet with the care pathways that we're designing. So it's a commissioning and delivery relationship and conversation, I feel.
Thanks, Charlene, and I completely agree. I think we're looking for that win-win-win in sustainability, both for the patients, clients, customers, and also financially, as well as being good for the planet. So I think it's bringing this into the conversation that's so important now, and how can we hit that sweet spot where we touch all of those things. So Lindsey, I'll maybe come to you now, because again, it's quite a challenging environment in care homes. I'm very aware, but what are the challenges when you're trying to implement some of these changes?
I think financially, definitely. I think a lot of the apps cost money to run monthly. It's a subscription, but also getting those apps to link up, because not every app will work with another app. So the app that we've got for care planning, you could use it for EMR, which reduces paper, but our pharmacy doesn't use our EMR, so we would have to pay for another app to use a separate EMR for that pharmacy. So you get, if they were a bit more streamlined and a bit more if they work together more, it would be easier, I feel, for care homes to be paper free. But also bringing staff along with you, because when you say we're going to cut single-use plastic and we're going to use less gloves and less aprons, they're all horrified, like, and you're like, well, if you're just using before COVID and you only used gloves and aprons when you did personal care, you did not use them all the time for every task. So why do you think you should be continuing that? If with good hand washing, good hand hygiene, you don't need to wear the amount of gloves that we were going through continually. So yeah, bringing staff along has been quite difficult. They see it, some of them are not, see it as pointless, or we're just doing it to cut cost, and trying to bring them along and see the bigger picture and actually see that this is going to affect us, our children and our grandchildren. That we're trying to help. We're not just trying to take their privileges away by taking away those extra gloves or just trying to reduce things. So yeah, it is a challenge to get people on board.
Absolutely, Lindsey. We see that across all of the care sector, where people think it's that one apron doesn't really make any difference, why bother? And so I wonder if I thanks Lindsey, come to Hatu and say, how do you bring your staff into that and help them understand? For me, it's not just the what we want you to do, but it's the why we need to do it and why we all need to do it. So that would be really interesting to hear if you've got any ideas about how you bring your staff on board.
Well, I kind of link with what Lizzie was saying there, because it seems like we've got similar challenges in terms of costs. Cost is one of the big challenges for us. And in terms of bringing our staff in, our staff team kind of are encouraged most of the time from the beginning, because we're not as a big organization as you as of yet. So we've started growing, putting this into our daily practice now. So try to encourage them to understand that majority of them don't have the means to drive anyway. So linking them with somebody else that drives within that same area kind of help the staff in terms of staying into work, and they see that as positive. So we got that advantage in that way. And secondly, we try to explain to them in terms of the impact on the environment and on our children and grandchildren. And majority of them are quite young. So I think they see that already compared to like a system that has been around for ages. So they understand that a little help goes a long way. For instance, when we go to our clients' homes, we make sure that we are the ones that take the bins and make sure we separate them and do the recycling for them and put them where it needs to be put in the light. So we're always encouraging them to make sure we turn all the lights. Even if we forget a light has been on, we'd always go back and say, yeah, we need to turn, because some of them can't obviously turn the light off themselves. So this is all part of our daily practice, and our carers are getting to learn this kind of benefits. So we are all able to kind of talk about it, how we can reduce even further. It's part of our conversation during team meeting, during supervision. So we try and implement this on a daily kind of or monthly basis. So they're always aware of how we can be even greener as a care organization.
Fantastic, thank you. And maybe just a question for all three of you as you're delivering direct care, because you've all mentioned financial constraints, and we've said that's one of the really important elements here. It shouldn't cost more, but you haven't mentioned that people are complaining about it. They're not having enough time to do these things. How have you managed to crack that one? Because that's something that I've often seen as a barrier to greener care. People saying, I haven't got time for that. We're busy doing this over here, looking after people. Have you come across that, or is it just part and parcel? Lindsay?
I think it's just part and parcel, really.
Right, okay.
Documenting on digitally is sometimes quicker. First, we've had challenges where carers are dyslexic, so whereas writing a care plan would be quite difficult for them,
right,
you can use text to speak on a computer, on a tablet. So actually, it makes these things easier.
Right.
I think the only issue that we've had from a time point of view is come from the kitchen, really, not rather than the carers. The carers just, do what you ask, but the kitchen, I think, is the only place that's kind of, I haven't got time to sort this and sort that, and it's like, well, you're going to have to, I'm sorry, but you're going to have to make it, because this is what we expect.
How interesting.
To happen.
Yeah, thanks, Lindsay. Charlene, any thoughts on that?
For us, reablement takes longer, because we often are supporting people to do things for themselves. Mm-hmm. So it would be quicker for us often to deliver the care to people, but our carers are very much, their ethos is they're happy to move slower if it means that adult can engage with the care practice and move to becoming more independent themselves. So I think they're used to that person-centered approach. And if it means that there are environmental adjustments or better working practices, that's kind of acceptable and is part of the way in which they're engaging with that adult. And I think it can be challenging, because you're supporting people in their homes, so you don't want to impose your way of engaging with the environment, I suppose you could say. However, I think it's bringing a different perspective that maybe some people from older generations that might not have been so commonplace. But I think there's definitely something about the fact that reablement care tends to be slower with the adult leading that care, and that gives us the time to do that.
Fantastic, thank you. So Tony, let me maybe come back to you. You gave us a few of the challenges that you've been experiencing, but are there any other thoughts that you have about how we can overcome some of these pressures on
Well, I was wondering whether I could follow up the
please.
the discussion that you've just had with Lindsey and Charlene. I'm going to talk about my time in Fife, if I may. There were 28,000 staff there, and one of the most common issues we got as feedback was there isn't a time for all these new agendas. We've got the day job, exactly as you described it, Elaine. And the breakthrough we had there was the implementation of personal learning accounts and passports, a suggestion scheme where we didn't reward people financially, we rewarded them with training time and bursaries for training. And that had an immediate impact because it allowed people then to create the space. And I do that in the current organisation as well. With our suggestion scheme, the winner each month has a 10-day break to work up their proposal and gets a bursary to fund that proposal. It's about creating organisational space to use things like the creativity techniques of De Bono, which we specialise in. And where in most cases, the risk is the day job doesn't allow you to have that thinking time. And so you have to go right the way back to the job description and say, right, well, what proportion of this job description do we assign specifically to give people a chance to reflect on their own practice, to learn, to develop, and if need be, to go and retrain, so that they're taking charge of those issues rather than us imposing those issues on them. And I think unless you've got that sort of cultural environment of a personal learning plan, passports, and support for people to actually go away and do the thinking time, the risk is that it's a very slow process of change. And there's nobody actually providing the overarching plan to enable that change to happen in an organised and structured way, because nobody's been able to go away from the job and think about it and come back with that solution. We have a philosophy of good enough, because there's a lot of change around sustainability that is ready to go, but people are waiting for the perfect solution. Electric cars are classic. Everybody's waiting for the day when you only have to recharge maybe 600 miles or 800 miles, you know, or once a week rather than once every 2 days in my case. That's not good enough. We need to grasp this technology now, because the technology itself won't develop any further unless it's being used now. And so the whole principle of good enough is there's a lot of things around insulation, for instance. We could achieve the ideal of perfect insulation in every property. We use a coefficient called R, and it'd be R equals 32. But the cost benefit between achieving it so that you only lose 1% of energy a day and losing no energy a day would take 1,000 years to repay. It's not worth waiting that 1,000 years. We can do it now and achieve 99% of the agenda. That's good enough, because it's done like better than where we are at the moment.
Fantastic, thanks, Tony. And certainly from a healthcare perspective, I'm seeing more and more healthcare workers challenging providers on giving us different solutions. And I think having that voice and being able to use that and say, why do we need this? Why can't we have something that's not single use or can be disposed of more easily? I think making people a bit more inquisitive is really interesting. So I know, thank you, Tony and Charlene, you had some ways you wanted to share with us about how you've engaged your staff and others in sustainability initiatives. Are you happy to share some of those?
Sure, absolutely. I think it's particularly coming kind of from a local authority perspective, there can be a tendency to set really grand or wide-reaching agendas, but the people who are frontline workers often have those really operational quick wins. So we've had some really great feedback. So, for example, our community frontline workers, they work from very early in the morning, sort of 7 o'clock in the morning, right through to 11 o'clock at night. And in the UK, that means a lot of their working hours are quite dark, often cold. And it can be quite tricky to find the homes of the people that we support, particularly when they're in more rural areas across Essex. So one of our staff members had the idea of a solar driveway light, so that it would be easier to find that person's home or the entrance to their home in a way that didn't alert other people around that there was a vulnerable person living in that home. We found that really useful because we have a sort of a stock of those, and as the customer moves on through our service, then we can very easily move that solar light on to future customers. There is also we've started using what 3 words at the suggestion of one of our frontline staff. And that's really, really useful because sometimes the homes in the communities, they don't have a number, they have a name for the house, for example, and it can be really tricky to find even with the postcode information. So by using what 3 words, they've got a more autonomy to be able to pop a pin exactly by the front door of that person's home. And that's something where they feel that they can share with each other. And that's included to the address location. Generally, we try to look at other ways of grouping together visits and making it possible for those community-based workers to feel that they are working as part of a team. And these sort of green initiatives are really wonderful because it's a colleague suggesting to other colleagues things that they found really beneficial.
Sure.
It brings together what are effectively lone workers in the community in a really lovely way.
They're great ideas, Charlene, and fantastic they're coming from the staff as well. That's what's really interesting. So, Lindsey, in your sector, have you got staff coming forward with ideas, or staff themselves thinking that we could be greener in our care sector, or not yet?
Not so much. I think the only one is our activities facilitator, who's a great believer in reusing, recycling, and you know, it's a very small start, but it's a start. And encouraging residents as well, things like turning lights off and TVs off when they're leaving rooms. So just, yeah, but mainly from the activities team rather than the care staff. They're not very green or forthcoming yet, but I'm sure that will come in time. The more we bang on about it, I'm sure the more we talk about it, the more they will pick up.
Elaine, I was wondering whether I could add to something Lindsey's just said.
Please do, Tony.
A suggestion for your activity advisor. Christmas is about the worst time possible for waste.
Yeah.
And it's about the best time to have sessions for reuse and repurposing. Because there is so much in the way of either packaging or Christmas cards or old presents or things we replace, etc., that we can reuse and repurpose. One of the things we're doing with a couple of communities, we're actually running repurpose and reusing workshops specifically in this month to target all the unwanted stuff that's come over from Christmas and how do we stop that from becoming waste. And it sounds like that might be something that might be of interest to your activity coordinator, particularly, as I say, at this time of year where there's probably going to be a lot more waste than usual.
Yeah, sure.
Great idea, Tony. Thank you. And
that's a great idea too.
We're all stealing that one. Lindsey, what about practical things in the care home, like food waste? Is that something, obviously there's a cost associated with that, is that something that has got onto your lovely kitchen staff's agenda? Is that without the reason I'm saying that is sometimes people are doing green things without even realizing that they're doing it, if you see what I mean.
Yeah. So kitchen waste really is with our kitchen. Our menus are set up around residents' meetings, so residents choose what food they like to eat. So that reduces waste because you're not putting things on the menu that people are not wanting to eat.
Right.
It's about getting to know your residents and making the menus and the meal sizes proportionate to what they want to eat, the amount they eat, how they eat, and that in turn reduces the amount of waste that comes back. If you know you've got 2 residents that like a really big, roast dinner, but then you've got another resident that only likes 1 potato, and then you put less on the plate, which reduces the waste. We buy fresh vegetables, so any waste from the veg goes to our guinea pigs. So the guinea pigs eat the veg waste, and everything else gets composted. The residents are actually growing their own herbs, so any compost that we create goes on the garden. So yeah, it's just reducing the amount of unnecessary waste. There will always be some food waste, but yeah, try not to be unnecessary and making use of what you do have left.
Fantastic. So again, Hatu, let me come back to you then. Are there any engagement with staff? Are staff feeling in your sector that they're keen to be engaged and involved?
Yeah, definitely. So we ensure that staff are directly inputting onto like our travel times and who they live close by. So with that, it takes a lot of kind of co-working and that building a relationship between staff so that we can reduce the amount of cars on the road at any particular calls. So we kind of ensure that what driver picks up and then the other person on the way, and that's their call, all goes within that same kind of area as opposed to one going east and one going north kind of thing. And that helps in terms of reducing the number of cars on the road. It costs a kind of like cuts on the fuel costs, which save us time and save us money as well, and improve the punctuality of the service, because if we're doing like double calls, we know that they're both going to be there on time because they're both traveling together. So and we get our staff involved in all that planning, and which help them in understanding that all that's done to kind of put out a good carbon footprint in the environment. Yeah.
Thanks, Hatu. That's fantastic. Tony, can I come back to you then, because your whole business is based around greener services. So presumably you attract staff who are that way minded already. But
yes, it's more a case of they engage me rather than the other way around.
Okay.
I sort of follow on their coattails, really.
Absolutely.
We are a bunch of enthusiasts, and we're also all unpaid as well. We're all voluntary. And we offer free advisory services for anybody who's doing any sort of design. It's not just houses. We've won an award recently for hospital design, so it goes on. We've done care home design, etc., etc. We will literally go in and we will turn people's ideas into a carbon neutral output.
Right. Well,
and we have so far succeeded every time. And in some respects, this is where I think the really big task is getting people to even think that they can be carbon neutral, because many people assume it can't be achieved and the technology is not with us yet. It's here and now and waiting to be used. And I've got a long list of technologies that are all early wins that I'll finish off at the end of the meeting with.
Yeah, please. So we'll come back for those early wins. But Charlene, any other things you'd like to raise today you haven't had a chance to share with us?
Makes me giggle. I'm going away thinking, how can I build a business case to get a guinea pig? Because I think that's an absolutely wonderful idea. And I think I can justifiably point people towards this recording and go, it was a recommendation. I think for me, what I really want to work on is to find that balance, I suppose, because technology can't replace all of the things that our frontline carers do. And I don't think we would want to necessarily, even if we could. So it's kind of trying to find that balance of being innovative and creative and working with health, for example, alongside social care, to find ways that we can reduce visits, maybe through district nurses and kind of sharing the information that we have. But finding a way to do that in a way that lessens the burden on our carers so that they can really have those quality conversations and quality support. So that's where I kind of see, for me in reablement, community travel admissions are always going to be our biggest challenge. We've done so much work on the buildings that our back office functions are in, and that's a lot easier to progress. But electric cars are absolutely something that we kind of want to move towards. It can be more challenging where the carers are, the wages don't necessarily mean that that's viable as a lease scheme, for example. So we'd love to find ways to do that.
Well, good luck on all of those initiatives, Charlene, and I do hope you end up with the guinea pig, but they are very noisy. I remember my sisters from years ago. Lindsey, any other things you want to add, or anything that you're going to steal today?
I don't think there's anything else I want to add. I just think today is my first ever meeting, and I found it really, really interesting. And there are some things that I'm going to take away. Some things from Tony, because we were actually looking to expand the care home. So we're looking at planning to build another on our land, but next door. So I'm looking that to be completely green, so solar powered, and yeah, so that is something definitely
fantastic
that I'll be taking away.
Thank you. And Hatu?
Yeah, to me, everything has been such a big learning as well in terms of kind of the consistency and making sure that we continue with the everyday practice and everyday approach that we do in terms of making sure we stay even greener. I would take on board all of your different kind of contribution, especially with the finding the clients at the right time. I think that has been a really good kind of feedback to take on. Yeah, that three words would be my highlights for today. Thank you very much.
Thank you, Hatu. And Tony, just share your last reflections with us.
Okay, I mean, the quick win. Every green space is an opportunity for a quick win. So any garden in any care home, any green space or courtyard in any hospital, keep the grass, but move towards aqua gardens, put ponds in, because they're better carbon sumps than trees. So look at your green garden design, get rid of annuals, plant perennials. That doubles up the carbon reduction from a garden space. And each 100 square meters of garden offsets half the carbon footprint of 100 square meters of building. So it's worth looking at. Micro macerations just coming out. So that's small macerators that will be around care home size. It reduces your waste and generates electricity. TENS, so that's thermal and to electricity conversion systems. So if you've got ground source heat during the winter, you can turn that heat into electricity during the summer and store it. Geothermal and gas exchange systems. Dig an artesian well. Best thing you could ever do. It will generate you electricity and it will give you free water. Wind turbines. They're now the size of a tin of Quality Street. You can stick them around gardens like garden gnomes. You don't need to get planning permission for them. But 10 of those has the same impact as one of the large wind turbines. Adaptive technology. For those who are in a heritage building, companies like Chameleon Solar can do a solar wall that looks like bricks or looks like cladding. And you have to, and when you touch it, it feels like those, but it's a properly functioning solar panel, but it's on the wall, not on the roof. Fantastic. The future coming around the corner and very fast is hydrogen and biofuel electricity generation. And we've got a couple of pilot schemes taking it into small residential houses. So if we can get it into houses, we can get it into hospitals and care homes. Carbon extraction technology is obviously what my own specialism is in, but water capture. We are losing so much water from old guttering systems that haven't been upgraded, haven't been properly designed. And then finally, the really quick win and the big win. If I look at just Suffolk and Essex, we have more permanently abandoned houses with nobody living in them then we have housing demand. All those materials are there to be used carbon neutrally in new housing, and yet we don't do so. We tend to turn it into rubble.
Well, Tony,
That's a shame.
What a place to end. We've got so many thoughts there, so many ideas. I think we could talk for the rest of the day, but we are back at the top of the hour. And I just want to take a moment to thank you, Tony, Charlene, Lindsey and Hatu for your fantastic contributions today. I will give the last word to John and say thank you so much for having us here this afternoon.
Thank you, Elaine. Bravo, all of you. What a fabulous session. Thoroughly engaging and interesting. Lindsey, the guinea pigs will live long in the memory. And I can imagine that the joy that they bring to your staff and residents as well. I full credit to you. I think really overall, I began my introductory comments, it sounded probably a little bit defeatist or hopeless. And at the very least, what you've done in the last hour is provide a little bit of hope. I think you've provided some sensible solutions. You've provided some lived perspectives and experiences. And I think you've given anybody who now watches this or who's been watching this either live or is now watching this via catch up with some perfectly sensible, doable, realistic, practical means by which they can influence their own environmental sustainability activity. So thank you. I must give a huge thanks to Elaine, who's worked tirelessly on this. And I don't know whether some of you noticed, but perhaps 5 or 10 minutes ago, her own personal butler appeared behind her, which was a personal real thrill of mine to see that, you know, she's living in that kind of style. So bravo, Elaine, for having that kind of immediate servant at your disposal. Can I also pay tribute to behind the scenes here today, Jade Maloney, who once again has been absolutely fabulous on behalf of the Institute. We look forward to seeing all the rest of you on further Greener Care group meetings in the future. And thank you so much for your time and attention today. It is appreciated. Bye-bye.